بسم الله الرحمن الرحيم. على بركة الله نكمل دراسة الاناتومي of the leg، وراح نكمل الفيشيال compartment of the leg. Regarding the anterior facial compartment, the main artery, or also called the principal artery, is the anterior tibial artery. It is the smaller of the terminal branches of the popliteal artery. It arises at the level of the lower border of the Popliteus muscle and enters the anterior compartment through an opening in the upper part of the interosseous membrane. The anterior tibial artery descends on the anterior surface of the interosseous membrane, accompanied by the deep peroneal nerve. In its upper part, it lies deep and beneath the muscle. In its lower part lies superficial, where its pulsation can be easily palpated. In front of the ankle joint, the artery becomes the Dorsalis pedis artery. The main branches from the anterior tibial artery are muscular branch to the neighboring muscles, which is the muscles of the compartment, and stomatic branches around the knee and ankle. Venae comitants accompanied the venae comitants of the posterior tibial artery to form the popliteal vein. The deep peroneal nerve. It is one of the terminal branches of the common peroneal nerve. It arises in the substance of the Peroneus longus muscle on the lateral side of the neck of the fibula. So it's closely related to the neck of the fibula. Any injury or fracture of the neck of the fibula might damage the deep peroneal nerve, leading to the paralysis of the muscle that's supplied by that nerve. The deep peroneal nerve enters the anterior compartment by piercing the anterior facial septum. So it passes from the posterior compartment to the anterior one through piercing the anterior facial septum. Then it descends on the anterior surface of the interosseous membrane with the anterior tibial artery. The nerve then passes behind the extensor retiniculum of the ankle joint. Main branches from the deep peroneal nerve are muscular branch to the muscle of the compartment, articular branch to the ankle joint, and cutaneous branch to the first and second toes. Now we start with the lateral facial compartment of the leg. It contains muscles, Peroneus longus and Peroneus brevis. Blood supply branches from peroneal artery. The nerve supply superficial peroneal nerve. Peroneus longus originated from the surface of the shaft of the fibula and inserted into the base of the first metatarsal and the medial cuneiform, supplied by the superficial peroneal nerve. The main function of the peroneus is plantar flexion of the foot at the ankle joint and everts foot at subtalar and transverse tarsal joints. وقلنا eversion هو lateral tilt of the foot at the subtalar and transverse tarsal joint. Also, it supports lateral, longitudinal, and transverse arches of the foot. This is the arches of the foot. We have the medial arch and lateral arch, the transverse anterior transverse arch، وتأخذوها إن شاء الله بالتفصيل من الدرسون تشريح القدم. Regarding peroneus brevis, origin from the lateral surface of the shaft of the fibula and insert into the base of the fifth metatarsal bone. وهذا الانسرشن هو نفس الانسرشن مال peroneus tertius. The nerve supplied by the superficial peroneal nerve. The peroneus brevis flex the foot at the ankle joint, also invert the foot at the subtalar and the transverse tarsal joint, while holding up the lateral longitudinal arch in the foot. Regarding the artery of the lateral facial compartment, numerous branches from the peroneal artery, which lies in the posterior compartment of the leg, pierce the posterior facial septum and supply the lateral compartment. Regarding the superficial peroneal nerve, it is one of the terminal branches of the common peroneal nerve. The common peroneal nerve gives us two branches, the deep one and superficial one. The deep peroneal, as we said, supplies the anterior compartment of the leg, while the superficial peroneal supplies the lateral compartment of the leg. It arises in the substance of the peroneus longus muscle on the lateral side of the neck of the fibula. It descends between the peroneus longus and the brevis muscle. In the lower part of the leg, the superficial peroneal nerve becomes cutaneous nerve. Main branches from the superficial peroneal nerve are muscular branches. Cutaneous branches from the superficial peroneal nerves are medial and lateral branches distributed to the skin on the lower part of the front and lateral aspect of the leg and to the dorsum of the foot. Branches supplies the dorsal surface of the skin of all the toes except the adjacent second and first toes, which is supplied by the cutaneous branch from the deep peroneal nerve. Now we start studying posterior facial compartment of the leg. The deep transverse fascia of the leg is a septum attached to the posterior borders of the tibia and fibula that divide the muscle of the posterior compartment into superficial and deep group. In this figure, we show the anterior facial septum compartment, septum ligament, posterior facial septum ligament, and this is the deep transverse ligament. The superficial group of the posterior compartment contains mainly the gastrocnemius muscle, plantaris, and soleus, while the deep group contains Popliteus, Flexor Digitorum longus, Flexor hallosus longus, and Tibialis Posterior. Blood supply of the compartment is the posterior tibial artery, while the nerve from tibial nerve. Gastrocnemius muscle originated by two heads, lateral head and the medial head. The lateral head from the lateral condyle of the femur and the medial head from above the medial condyle, and inserted via tendocalcaneus into the posterior surface of the calcaneum, supplied, as we said, by the tibial nerve. The main function is plantar flexion of the foot at the ankle joint, and also play a role in flexion of the knee. The plantaris muscle originated from the lateral supracondylar ridge of the femur and inserted separately to the posterior surface of the calcaneum. The nerve supply is the tibial nerve, and also plantar flex the foot at the ankle joint and play a role in flexion of the knee. The soleus muscle arises from the shaft of the tibia and fibula and inserted via tendo calcaneus into posterior surface of the calcaneum, supplied by the tibial, and the main function, together with the gastrocnemius and the plantaris, act as powerful plantar flexors of the ankle joint, provides the main propulsive force in walking and running. The deep group of the posterior compartment. We start by the popliteus muscle. Popliteus muscle arises from the lateral surface of the lateral femoral condyle and inserted into the posterior surface of the shaft of the tibia above the soleal line, supplied by the tibial nerve. So this figure illustrates the popliteus muscle arises from the above the lateral femoral condyle into the posterior surface of the shaft of the tibia above the soleal line. The main function of the popliteus: flexion of the leg at the knee joint. Also, it unlocks knee joint by lateral rotation of the femur on the tibia and slackens the ligament of the knee joint. So it acts as a flexor of the knee and unlocking the knee. This movement, the unlocking of the knee, is an important movement. We will discuss it in details when we studying the knee joint movement. And also the popliteus arises inside the capsule of the knee joint. So the tendon separates the lateral ligament of the knee joint from the lateral meniscus, so that the meniscus is not tethered to the ligament and is free to move. So in this position, it acts as a piercer to separate the lateral lateral ligament from the lateral meniscus. Regarding flexor digitorum longus, it originates from the posterior surface of the shaft of the tibia and inserted into the bases of the distal phalanges of the lateral four toes. So it is contain 4 slips, each slip for 1 toe, supplied by tibial nerve. This is the slips of flexor digitorum longus. The main function of the flexor digitorum longus is flexion of the lateral four toes and plantar flex foot at the ankle joint. Also support the medial and lateral longitudinal arches of the foot. Flexor hallucis longus, originating from the posterior surface of the shaft of the fibula and inserted into the base of the distal phalanx of the big toe, supplied by tibial nerve, and acts as a flexor to the big toe and plantar flex foot at the ankle joint. Also support the medial longitudinal arch of the foot. Tibialis posterior, originating from the posterior surface of the shaft of the tibia and fibula and interosseous membrane, were inserted into the tuberosity of the navicular and other neighboring bone. Nerve supply: tibial nerve. This is the insertion of the tibialis posterior into the navicular bone. The main function of the tibialis posterior: plantar flexes foot at ankle joint and inverts foot at subtalar and transverse tarsal joints and support medial longitudinal arch of the foot. بالحقيقة هي the main inverters of the foot. The posterior tibial artery is the larger terminal branch of the popliteal artery. It begins at the level of the lower border of the popliteus muscle and passes downward in the deep posterior compartment with tibial nerve. In the lower part of the leg, the artery is covered only by skin and fascia, so that the pulsation of this artery can be easily palpated behind the medial malleolus. The artery passes behind the medial malleolus deep to the flexor retiniculum. Here you can feel its pulsation, then terminates by dividing into medial and lateral plantar arteries to supply the plantar component of the foot. Posterior tibial artery branches. First, peroneal artery, which is the large artery that arises close to the origin of the posterior tibial artery. Peroneal artery is the large artery that arises close to the origin of the posterior tibial. The second branch, muscular branches. Third branch, nutrient artery to the tibia and fibula. These nutrient artery penetrate to the bones. Anastomotic branches around the ankle joint. Medial and lateral plantar arteries. Venicomitant joins those of the anterior tibial artery in the popliteal fossa to form the popliteal vein. Regarding tibial nerve, the tibial nerve is the larger terminal branch of the sciatic nerve. It descends through the popliteal fossa and passes deeply to the gastrocnemius and soleus muscle. It accompanies the posterior tibial artery. Both the artery and nerve passes behind the medial malleolus between the tendon of flexor digitorum longus and flexor hallosus longus, and then divided into the medial and lateral plantar nerves. The main branches from the tibial nerve below the popliteal fossa are muscular branches and articular branches to the ankle joint. Also give cutaneous branches to the medial, what we call the medial calcaneal branch, supplying the skin over the medial surface of the heel. Also give us the medial and lateral plantar nerves. This is branches from the tibial nerve at the level of the ankle and foot. Thank you very much for your careful listening.